So we're talking about natural healing on this episode of New Answers. And this is natural healing of our bodies when we're challenged and the pharmaceuticals, I was going to say traditional remedies don't work. And I've come to believe that because of the because of the higher power, our bodies are given the ability to self-heal. I'll go that far. And I'm going to do a disclaimer in a minute. But so we're going to be talking about our bodies in natural healing processes. And hi, everybody. I want to welcome you to New Answers podcast. And you know that we are a community of everyday people who share solutions to life challenges. And this is from our personal experiences. I'm Gwendolyn Flynn. And as usual, I'm joined by Tiffany Lee. Hi, Tiffany.
Hello.
And today we have another subscriber who's joining us. We want to welcome Diane Houston to this conversation. Hi, Diane.
Hi, Gwen. Hi, Tiffany.
Welcome.
I'm so excited to have a subscriber join us. You're a second subscriber that's joined us. Let me just say that. uh, in the conversations that we've been having around nurturing spirituality. So, as I was saying, sometimes the pharmaceuticals, when our bodies are uncomfortable or in this state of dis-ease, doesn't always have the answers to what ails us. And we have to look for alternative remedies. And and with these alternatives, we need to connect to the source of all creation for guidance on how to help our bodies heal. Is because as I was saying, I think that we do have this natural ability to heal some aspects of, whatever may be coming our way. Not everything, of course. Um, and so let me just start out by saying, and I'm going to remind people too, that first of all, we are not trained physicians. We're just sharing information from our personal experience. For anything that you hear that resonates with you, we suggest that you first, before taking anything on, consult with your physician, your medical practitioner, before you try anything from what we say. So, and we're not here to advocate against medicine because medicine does have its place. We just want to broaden, I guess, the options that are out there and encourage, self-healing as a way to begin to address certain issues that may be affecting our bodies. So, so let's talk about some of the conditions that we have been experiencing and what we've done about it. Um, let's start with our guests. Let's let Diane go, then Tiffany, you talk about yours, and then and I'll talk about mine, and we can get into what we did, to overcome whatever it is that was ailing us. All right, Diane.
Yes. About 30 years ago or so, I was diagnosed with fibromyalgia. And at that time, I think they had just labeled that fibromyalgia. In the past. Before then, they called it,
Chronic disease, right?
wow, chronic fatigue.
Chronic
Chronic
fatigue.
fatigue. Yeah, thank you. Um, and they didn't know what to do with it because there's so many different symptoms that go along with it, and as in my opinion, it the symptoms mocked other things. So
Mm,
I would get pains or muscle spasms, all different types of symptoms, and I would go to emergency and find out what it was. I mean, the pain was bad. I usually waited until it got bad enough where I couldn't deal with it before I go running looking for help. And pretty much they couldn't find anything wrong with me, but they'd give me a prescription to alleviate the symptom, usually pain injections, things
Hmm.
like that. And
So it
yeah,
wasn't just a pill, it was injections of some kind. Oh.
I don't know if you want me to label what the medication was.
No,
Excuse me,
no,
my battery.
okay.
I'm sorry.
So while you do that, so Tiffany, you've heard of chronic, what is it called again?
Fatigue
Chronic
syndrome.
fatigue syndrome.
Yeah.
Yes. You've heard of that before, right?
I feel like I have. I didn't know, but I don't, I have heard of fibromyalgia. And it seems like a lot of people are getting that diagnosis these days.
Yeah.
I'm hearing about it a lot now. Yeah. So,
So- And so to me, this tells me that, the medical community isn't all knowing, Like first of all, you were
well, Gwen, let me interrupt real quick. It's called the practice of medicine. So they're
yeah,
not all knowing. It's in the name that they're constantly practicing.
Yeah.
exactly.
I have, for my
That's a
studies
good point.
recently this month, I have some more input to put into from a spiritual standpoint of why, of how our bodies heal themselves, that they do know, that the medical industry does know. And I did kind of a deep dive into why, when they're testing medicines and they test them against a placebo, they know that our body heals to a certain extent by just telling us, like, this pill is going to heal you. Your mind, your subconscious mind takes it in and it starts healing because we, like, whatever we believe in. So when they test a medicine, they're testing it above. How far above does it work the placebo when they're just giving people a fake pill and telling them this is medicine?
Hmm. Yeah, see?
Yeah.
And for a long time, I mean, we really put our trust in the physicians, the doctors. Just kind of giving them almost carte blanche because they went through medical school, they went through all this training, and so they know, but they don't. And like you say, Tiffany, this is a practice. They don't know everything. And so, Diane, when you were experiencing these conditions, these symptoms a long time ago, they didn't even have a name for it. They were calling it um, chronic fatigue
Okay.
syndrome.
Yeah. Yeah.
So that's what they kind of called it. And then as they started to learn more about it, now it's become another name. They've given it a more, I guess, a medical name,
Right. The
the
fibromyalgia,
fibromyalgia.
which means muscle fiber pain.
And so your experience for this, the symptoms that you were having was, as you were detailing it, right? It was your muscles were hurting, and what other symptoms did you have?
Muscle spasms. And now I realize when my muscles were spazzing out, um, it affected my joints because your muscles support your
Your
skeletal
joint.
system. So my muscles would contract so bad that when they finally relaxed, my bones hurt because my muscles were squeezing and pulling
So
my
tight.
joints. Yeah, to I guess contort, so to speak, in a way. And then when it relaxed, it hurt. My bones hurt. So I was told by this one doctor, "Oh, you probably got bone cancer." And I
Oh,
found out later on in some of my research that it all has to do with the inflammatory process that the body goes through. And
right.
we get inflamed, our bodies become inflamed because we've been taking in food that has additives or preservatives in it that's working. This is my opinion, that works against the body. And
Okay.
this is what I've experienced.
Okay. So we want to get into that, like the research that you've found and the research that I found and Tiffany too. Let's hear from Tiffany about the condition that, brought you to, the fact that you needed to learn more,
Natural
because you were,
medicine.
yeah, because you
Um,
just weren't getting it from the medical community. Okay.
right. Mine started, um, well, actually all my life as a child. So mine is similar to fibromyalgia. It's rheumatoid arthritis, juvenile rheumatoid arthritis. So
Mm.
I was studying to be a ballerina, and it was like a week before my audition for American Ballet that my inflammation got out of control. But I had it throughout my life. Like from the time I was young, it just would show up a little bit, and no one really listened to me about it. Like when I would say I can't hold a pencil when I'm trying to learn to write very young, or I couldn't sit cross-legged very well. Um, but then by high school, later years, because I was training in my ballet so much, it was a lot on my body.
Gosh.
Plus, coming from a traditional Southern family, my mom's Southern and my dad from Louisiana, Chicago, but Cajun. Like our diet wasn't like the healthiest. And then me being a ballerina, being like I needed to be super skinny, so I
Mhm.
was bulimic at the time. So my parents, traditional family, made us eat the dinners, and then I would go upstairs and throw up because I couldn't have any weight on me as a ballerina. Um, and it's my so so I would have swellings. I would go to the doctor, and their doctor would be like, "Oh, it's just dancer's knee, dancer's elbow pain." They always wrote it off, so I would just naturally ice and wrap after every day. And then finally one weekend, I had a weekend free. My cousins were picking me up. I had iced and wrapped my knees already after my classes, and that evening the pain just would not go away. And my cousins picked me up and took me spending the weekend with them in Hollywood. So we went to the restaurant, and I was like, oh, my knee is really hurting. So we bought me some Advil. We went into the restaurant. By the time we were done eating, I had gotten so inflamed. They had to carry me out the restaurant, carry me to their apartment. They gave me a Bengay and Advil. I was taking it all night. I was up all night. By the time morning came, my knee was a football. It was literally the shape of a football, and they had to carry me home. It took the doctors about, it took them 3 months. So within a couple days, my second knee swelled. And still they were saying dancers' knees must be an injury. And they just were like sending me to physical therapy. It was an assistant at the physical therapist's office. I talked to my mom after like 3 or 4 months. I said, she's not getting better at all. Go get her tested. Go to a rheumatoid doctor and get her tested. So once they tested my blood, they knew it was rheumatoid arthritis, and he had to drain it and stuff. Um, what happened with me was I naturally, like my brother was chewing on these vitamin C's, and I was like, "What are you chewing?" He's like, "Vitamin C. It's not even the flavor kind." So I took one, I chewed it, and my body was like, "Yes" to that. I
Mhm.
craved vitamin C to the point where my neighbor's mom went to Costco and she would buy these big big jars of vitamin C's at Costco. And it's the big white ones. They're like
Mhm.
sour. I would take handfuls, carry them, and chew them all the day. And
Mm.
that put my rheumatism in remission after a while.
Amazing.
Awesome.
It's
Yes.
amazing. But and it was by accident, basically. It was like happenstance, right? That you came across
Yeah.
this solution.
And it was just my body was like craving it. Like when your body gets something that it
Yeah.
needs, it will crave it. And so it can come in a natural form, or like, let's just say you eat a piece of candy that has my body needed the vitamin C because vitamin C's control swelling,
Hmm.
inflammation.
Hmm.
And um, if it would have been in a piece of candy that had, for some reason, like wherever it's like, oh, I need that, then you're going to crave it more. So it's best to go as natural as possible, obviously.
Hmm.
Now I try to do it with garlic, onion, bell peppers. Those are all strong in vitamin C. and it has a quicker response to like anti-inflammatory or turmeric and stuff like that,
hmm
you know, than
So
a vitamin.
did so with your condition though, before you discovered the vitamin C and these other, did the medical community offer you any remedies? I mean, I know that they didn't fully understand what it is you were going through,
The
but
rheumatologist, once he pulled the water out, then he put me on some strong medicines that gave me like an ulcer.
oh
So I'm not a fan. I'm not a
yeah,
fan of medicines.
yeah. Same here. So now, so as I'm listening to both you and Diane, I'm trying to think, okay, so what is my condition again? So a couple of things that come to mind. So one is fibroid tumors. And I've had fibroid tumors for a long time. And at one point, I had a partial hysterectomy, which usually fibroid tumors show up in the uterus of a woman. And with a partial hysterectomy because of the symptoms of the fibroid tumors. I don't know how detailed I need to get into those symptoms in this, because it's indelicate kind of conversation. But anyway, uh, there was a lot of pain associated with the tumors, and there was excessive bleeding. Let me just say it like that. Okay. So then I had a partial hysterectomy, and which meant they removed my uterus. And then a few years later, the tumors showed up again without a uterus. So they usually, attach themselves to a woman's uterus, and that's how they grow. They showed up again, and I had no uterus, and I was postmenopausal. So it's like, and nobody had an answer for me as to why these were showing up. And it wasn't until I got excruciating pain that I went to the emergency room and figured out what was going on, and it was a fibroid tumor. I said, that can't be. I don't have a uterus. How could? So anyway, so there was that. And then there's also, I have osteoarthritis, which is a deterioration of the cartilage between your joints, basically. And it's just you can't prevent it necessarily. It's just wear and tear on your body. And but the first thing that the medical community said to me was, you need to have a hip replacement. And I said, what? What? It's like, aren't there some steps before you get to that? Like,
Right.
isn't there like physical activity, or there's something, not physical there, physical therapy? Is there some, can I do? No. And so I thought, well, I'm gonna figure this out myself. I had to do my own research because there was no other solution. It's like you have to have the surgery. And and then it was some time before I could get the surgery scheduled. And in the meantime, I was in excruciating pain. So I had to do some figuring out. So with the fibroid tumors, did some research, and I was looking at what remedies that were out there, and what came to me was the use of turmeric. That's a root um, vegetable. I don't know how you would call it.
Root.
But it's
This
a
is called a
herb.
root. Yeah.
It's a root, yeah, and it's kind of an herb. And that taking in turmeric in whatever form takes down the inflammation. We're all talking about inflammation. I'm gonna get to that in a minute. It reduces the inflammation, and it reduces the pain. And that's what helped me get to manage the pain between the time that I was diagnosed and the time that the surgery was scheduled. Where the fibroid tumors were concerned, I learned that they're fed through blood and through hormones. And I thought, can't be my hormones because I'm postmenopausal. Like the hormone level is reduced. And so I thought it might be the animal protein that I was eating, that because they inject the meats, whether it's poultry or beef or maybe even pork, with hormones so that they fatten them up and they can, sell them at a higher price. So I eliminated animal protein from my diet for a while, but I learned later that that wasn't it either. But anyway, it puts you on this path of you having to do the research for yourself to figure this out because the medical community doesn't have the answers. And so well, anyway, so that's my story, couple of stories. So let's go back to talking about the inflammation. Diane, what did you say you discovered in your research about inflammation and what you did about that?
Um, After going through, at one point, I was taking 22 pills a day for the fibromyalgia. The fibromyalgia, I fell into a place of depression. It was bad.
Wow.
Um, and so I was given all these pills to take, and I put on so much weight. I could hardly breathe or walk. And they were saying, "Oh, you're gaining too much weight. You need to exercise," the whole thing. And I said, "You know what? I can't do this." And I just stopped taking everything. I wouldn't recommend that for anyone else, but I prayed. I prayed. I said, "God, you got to help me. I can't do this." I was only 50 years old, taking 22 pills a day. It was
Yeah.
crazy. And none of it, some of the medication helped, but only for a short period of time, maybe 3 to 6 months. And then there were medications that just tore my stomach up. And I said, "Wait a minute, your stomach is a part of your you know um, part of the healing process and feeding the rest of your body. If I keep destroying my stomach, I'm not going to be able to get nutrients to the rest of my body." So
Yeah.
I did a whole body cleanse,
Mm.
and I started taking vitamins, the vitamin C, perfect example.
Mm.
I started taking that. And of course, then I have this closet full of vitamins. So after a while, I got tired of swallowing vitamins. And then the NSAIDs didn't work. I had an allergic reaction to ibuprofen. So I can't take ibuprofen. I was taking pain injections, and the injections that I was getting had ibuprofen in it. So I couldn't take the injections anymore.
Mm.
What am I going to do? So, not taking the NSAIDs, I decided to look up, and it just occurred to me, what are you eating that's causing the inflammation? So I looked up anti-inflammatory foods, and I started shifting my diet,
Mm.
and I began to notice the difference. The first one I tried was pineapple, fresh pineapple. It has bromelain in it, and it's good for your joints. And oh my God, I was blending up and juicing pineapples and anything else that I could find in the food, and fresh produce that would help with inflammation. And that kind of got me kick-started into changing my diet. And none of the doctors told me that. What are you eating? You remember years ago they used to say you are what you eat?
Yes.
And then a few years later, they shifted that and said, "Nah, you can eat anything you want." That's like, so now I'm back to you are what you eat.
Yeah.
Or food is your medicine.
Food is your medicine.
Yes.
Yeah. Yeah.
Yes.
Mm-hmm.
Yes.
Mm-hmm.
So that's where I'm at right now. And I don't take any medication for
Good
the
job.
fibromyalgia.
Good
You
job.
don't take, so you're off all those meds, really?
The only medication I take right now is high blood pressure medication. And
Yeah.
that wasn't high, I was borderline.
Yeah.
So, and I realized some of the foods I was eating was causing my blood pressure to go up, as well as diabetes. They kept saying, "You're
Yeah.
pre-diabetic, you're pre-hypertensive." It's like, well, how do I get unpreed?
Right. That's the thing. That like I did some research on the pre-diabetics. I was like, what? It seems like someone mentioned it to me when I first saw it. My doctor never told me, but about 5 years ago, when I turned 50, because I'm 55 now, it was, I saw it on my medical records, pre-diabetic. And I was like, pre-diabetic. And I was talking to some girlfriends, and she's like, oh, everyone is. Like they just throw that on there these days. I was like, well, that doesn't sound right. You know what I mean?
You know.
They didn't talk to me about diet, nothing. So our medical industry in America, they don't take from what I heard, they do maybe 2 weeks of nutrition.
Yeah.
We're not healthcare really. We are more sick care. So you
Yeah.
go when you're sick and they prescribe medicines. And that I had a download about the cycle of how our body works and medicines, which I'll get to later. But it's why we end up on more and more and more medicines. And that's kind of like the pharmaceutical companies kind of run the country, really. They're all attached to our food, our medicines, everything. It's one industry. Food and drug industry. Like, does anyone catch on to that? Our food and drug industry is one industry.
I did just now.
I know. So did I, because I
Yeah,
didn't before.
yeah.
Yeah.
Wow.
It's
Yeah.
and here's the thing, truth is in our face.
Yeah.
When we really think about it, the truth is in our face. And that's why when it dawned on me, I was like, when they're testing a drug, they tested a placebo. They tested against nothing other than telling the person you're taking medicines and this is what it's going to do. And the result is not that those people don't get better. They get better. That's why they test against it because they know the truth is in our face. They know that just by telling someone, here's a pill is going to make you better, that the mind automatically starts making the body better, obeys it. And so they
Mhm.
have to test it. How much better can it be than what the person naturally does? That's wild. Okay.
Yeah,
It
it
is.
is.
So my download after that, I'll get to it later. But let's talk about I love the pineapple.
Yeah.
I only discovered pineapple this year and I started adding turmeric. I'll buy pineapple juice. You buy as natural as possible. Juicing it's best. And then I add turmeric powder to the pineapple. And yeah, I was having inflammation problems this year and it's immediate, right? It starts working immediately.
Yeah.
Yes, it does. Yeah.
Yeah. So for me, what I guess I, kind of set up for what my condition was that started me on my research path. And because like I said, the doctors couldn't tell me, well, what causes these fibroid tumors so that
Mhm.
I could, stay away from whatever it is and be able to, control it. They didn't know. And so this was a primary physician. And then I went into a gynecologist who didn't know. And then in my research, didn't know exactly. I think they did finally at some point along the line of my sort of treatment was the revelation that hormones and the, I guess, blood somehow correlates to the development of these fibroid tumors. But it's like, how do you, okay. So hormones, I thought, okay, maybe I can control that. I don't know about the blood thing. Um, and that's when I decided to cut back on any animal protein because I thought it wasn't coming from my hormones because I'm postmenopausal, right? And your hormone levels decrease as you get older. So it could be the hormones from the animals, as I said before. So I cut back on that. But then I also learned about the inflammation and how some of the disease or some of the pains that we experience comes from the inflammation of tissue or material around us, and and that there are some foods that can contribute to inflammation in addition to whatever your physical thing is. And so and I learned that inflammation was somehow related to um, I don't know if it was necessarily the development of the fibroid tumors, but certainly related to the uh, the hip and the deterioration of the cartilage. Um, um, so anyway, it was about pain, the feeling of pain, and inflammation contributed to that, to that feeling of pain. And I learned that turmeric was one of those spices, foods, root vegetables that you can take that would control that would lessen the pain. That and then what is it? A black pepper helps your body to absorb it quicker. And some other thing. I'm trying to think of some of the other remedies that I guess I learned that there's such a thing as nightshade vegetables, and I guess we're all different. And so but I read somewhere that nightshade vegetables are some of the produce that can contribute to inflammation. And so I started to nightshade vegetables included like tomatoes, and you think about where tomatoes are used, like in tomato sauces and soups and all that, and so I had to stay away from that because even with taking in the turmeric, if you continue to eat other foods that contribute to inflammation, the turmeric will be nullified. The effect of that would be nullified. So I had to stay away from tomatoes and eggplant, I guess, is a nightshade vegetable. I think even onions might be too, but I can't stay away from onions. So so if I take those things in, I know I'm going to suffer. But I try to stay away from so I can reduce the level of inflammation. So that's kind of the path that I went down in terms of what I discovered in the research that I did. And I also learned that, and I think you said this too, Tiffany, that the medical community, doctors, they don't get a lot of training regarding the effects of what food you take in and how that affects your body. And I found that, I was stunned by that because I thought the medical community, um, what is that expression about food? Let food be
Medicine.
your medicine. Yes. And medicine be your food. It's like, and isn't that part of the Hippocratic, no, maybe it's not part of the Hippocratic oath, but I thought Hippocrates,
I think that's
Hypocrisy.
came up
Eastern
with that.
medicine. Yeah, I think it's Eastern because that is Eastern medicine. That is their belief. Like food is your medicine.
Food is your medicine.
And the
Yeah.
way in some Eastern countries is doctors get paid to make you healthy. Here, doctors get paid to give you medicine, to diagnose
Yeah.
you and stuff like that. So doctors get paid if their patients don't get healthy out there. So, and yes, food is your medicine really comes from Eastern medicine because here where we're such a capitalist country and um it was the Rockefellers that
Yes.
to steer people away from natural medicines
Yeah.
because they are part of the families that are involved in the pharmaceuticals.
Pharmaceutical. Yeah. 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 So, yeah, I found that Western medicine is comes to healing from a place of disease pre, disease management and treatment
Yeah,
and
non-prevention.
not disease prevention.
Right.
No. Right.
And prevention is less expensive, because obviously, right? And so that's the approach that the Western medicine takes, like you said, Tiffany. It's not about healing, basically. It's about treatment and management. And that's where they think they can make their money as they're developing these pharmaceuticals, these synthetic sort of approach to this. Although some of the pharmaceuticals are based in the foundation comes from, the natural herbs that are out there, but they add, these things
They
to
add to it. Yeah. Let's
that.
let Diane finish talking about what she discovered and
Yeah,
what she's doing about because a lot of people are suffering from that right now. A lot. So
I
this is
of
great
fibro.
information. And
Yes, yes, I
Yeah.
do. Yeah. So I just want, there was one last point I was going to make, but now I've lost it. Go ahead, Diane.
I'm sorry. Yeah, I think the deal with pharmaceuticals is they want to synthesize and make money off of what God has given us to
Mhm.
heal us. Um, Back to the anti-inflammatory foods, if that's what you wanted me to share. Um, After the pineapple, I found out about beets.
Mm,
Beets are good, especially for athletes. There's something, a product that your muscles make when you exercise. If you don't get those out of your muscles, that's what causes the cramping. I think it's called lactic acid. I'm not sure.
yeah.
But the beets, I think, provide, is it nitric oxide? That helps to get rid of that byproduct out of your muscles. So I've done, I do smoothies with pineapple, beets. I put in fresh, and they're all fresh foods, fresh fruit, cranberries, um, ginger,
Hmm.
honey is good, turmeric, and as far as whole foods, radicchio, collard greens, rapini. Those bitter greens are awesome for joint pain. And so I eat a lot of salads with radicchio. I make my own salad dressings because you're trying to avoid as many preservatives, you know, so that your body doesn't accumulate all those toxins from
Right.
preservatives. And physical therapy. If I start hurting my joints, I know my muscles need to be toned and stretched. And
Hmm.
so I do the physical therapy and I try. Now, I cheat. I cheat from time to time on what I eat. But I think the thing is moderation and balancing. If you're going to have a steak, have an anti-inflammatory vegetable or fruit with it so that it
That's
will
a good
counter.
one. I like that advice.
Yeah, so you're counteracting and you're not overloading your body, with things that are going to inflame it. Pomegranate juice, tart cherry juice. What else? Rosemary, rosemary herbs.
Let me talk about rosemary.
Okay.
Rosemary is magic.
Yes,
Rosemary is magic.
yes.
Rosemary does so many things. Rosemary is immediately will like take care of pain and swelling.
Mhm.
I use a lot of essential oils. So if I have swelling or pain, like really in my hands when I was going through some treatments and the perimenopause kicked in and ugh, all that, the rosemary oil, I discovered that rosemary oil also is good for hair loss.
Yeah.
Put it on the scalp. Yeah, so
Mhm.
it's pain, swelling, hair loss. Who else knows what else?
And didn't
Thyme.
you mentioned oregano oil too? Is it, did you
Oregano's my Bible.
okay,
Oregano.
see, I thought so.
So
Okay.
I never took my kids to the doctor for a cold or flu or anything like that. We use oregano oil, and
Wow.
it will, to even with COVID, pretty much would take care of whatever the ailment is within 24 to 48 hours. So my kids always have a oregano roll with them. I'm like, are you feeling something? Start rubbing it in. It's very strong. My kids have been and me have been using it forever, so it feels like it burns you. So you can mix it with like coconut oil or olive oil or something. But there was a high school kid recently that did a test with oregano oil and antibiotics and in test tubes, and the oregano oil with one drop just like wiped out the viruses, where the antibiotic it took multiple drops to wipe it out eventually.
Wow.
Yeah.
Well, I haven't. I don't. I'm in the process of taking an aromatherapy class, and I haven't. I wished I had started with herbal medicine first, because herbal medicine is what makes the essential oils, the
Mhm.
the herbs that you use. And so I kind of did things backwards, but I've never tried the oregano. Um, Thyme is another herb that is good for pain, joint pain.
Oh, okay.
Um, what else? I found out clove oil. Cloves are good for pain, and it's also good for oral hygiene.
Yes. Yeah. It's the
Yeah,
first if anyone has a toothache, put some clove in there, and
yeah.
it's going to numb you right away. And then it's kind of a painful combination, but what I'll do is I do the clove to numb, and then the oregano to kill any type of bacteria or
Mhm.
inflammation, whatever's causing and to kill the infection. So, but
Mm.
it's a temporary pain. Like the numbness is only going to be there for a couple minutes. The pain from the oregano is only going to be there for about a minute, but it's oil. It's going to be working, and it's like I can take out the swelling out of someone's mouth within right. It's really immediately when you use these natural products. It's immediate.
Yeah.
Yeah,
The
let me insert in here just a couple of things. One, a thought that occurred to me, and then I want to kind of a reset for people who are just tuning in. Um, the one thought I wanted to insert was, I know we're going into the talking about oils, but I remembered that dark berries was another food that you can intake that helps with reducing inflammation. So dark cherries and blueberries and blackberries, those have properties in it that helps to reduce inflammation. And then just as a reset, for those of you who are just tuning in to us, you're listening to New Answers podcast. We're on our series of spirituality, nurturing spirituality, and our topic today is about natural healing. And we want to say that we are not physicians. We are just sharing information from our own personal experience about how we have come to heal our bodies using the natural products that are out there. If you hear something that resonates with you, we ask you to consult with your physician before you take it on. And we're not about advocating against medicine, the use of medicine. We just want to sort of expand your knowledge about other options that are out there. And for me, I want to say this before we get back into the conversation about the other oils that are available that are beneficial to us. The pharmaceuticals, long-term use of those damages your organs if you don't know that. If you use them for long periods of time, you can find that your liver and kidneys that are the filters for your body they start to deteriorate. Using these natural products, I haven't heard of anything that has caused damage to organs. And so that's another reason to kind of expand your knowledge about what else is out there and to work with your doctor as part of your health team. Not that your doctor is a enemy, obviously, or but really engage with your doctor because you know your body better than anybody else. You could tell your doctor what is going on with your body, and you work together in tandem to come up with a solution to whatever it is that's ailing you. So now we're talking about oils that are out there. Um, Oregano oil, you mentioned thyme, Diane. Are there other oils that are out there that people can, and these are not necessarily taken orally. You're talking, these are topical you're talking about, right?
So with the essential oils, you have to look at the bottle, and if it says food grade,
Mhm.
you can take it orally. But if it doesn't say
Okay.
that, then you don't want to. Others, and I forgot the name of the brand I like best, which I know I can take orally, and I will take it orally because I like it to just be as powerful as possible. But what people don't understand is when you put stuff on your skin, it's it's still going into your bloodstream. So when they say it's topical, it's there's not that much difference between putting it on your tongue and putting it on your skin. And that is part of the lack of knowledge of what's causing illnesses. The reality that we're taking in so many toxins multiple ways that to do your best to like give your body a break. It's constantly working. to reestablish itself to its perfect place is what our body does. So when we call ourselves sick, I don't use the word sick anymore. I say my body's working, because all the symptoms when we're sick is God put in our in our bodies. It's our body working to get it back to its optimum place.
Right.
So when you have swelling, when you have a cold, when you're coughing, that's your body working, being like, hey, there's an invader in here. And it's the natural functions to like get it there. So when you take something that actually that's not natural, that's pharmaceutical, that is, if you have a cold and it's like clearing it for you, well, what is it really doing? It's telling your body, we don't want you working. We're going to substitute what you naturally do and with this pill. So what happens to your body when you, let's just say, simple thing is like when you're constipated and you take a laxative and the laxative like cleans you out. But the reason why you can't do that often is because your body will stop working itself and then you get stuck on a laxative. And that's the danger in pharmaceuticals.
It causes a loop.
Mm-hmm.
Yeah.
100%. That's right on the download I had recently. Is that because our bodies naturally are made to heal. When we do, and as you know, like once we tell our body we need to heal, you can talk to your body, by the way. It has its own brain. Talk to your
Yeah.
body. When we take that pill and we're telling the body you don't need to do this, then it can stop working. And then that that but okay, so say you get something, your body's all these symptoms are happening, your body's working. You take a pill, you tell it to stop working, we're going to do it instead. Then that
Mhm.
pill, the pharmaceutical, has its side effects. And so that's a foreign object to your body. Then your side effects is your body working to overcome that pill, whatever it's doing. It's a foreign object, okay? And so then the doctor prescribes another pill
Mhm.
and then new symptoms. That's your body working again. So you see how you're overworking the body, getting caught in this loop. So
Yeah.
my mom now is 84 years old. She's someone that's been on medicines forever. Her cabinet is full of meds. When she gets sick, her body doesn't know it. I have to watch her closely
Mm.
because it no longer gives her symptoms. And that's how she ended up in the hospital with what's it called? And a lot of older people get it, but it's basically her whole blood system gets infected because her body no longer works on its own.
Septicemia.
Sepsis, yes.
Yeah.
Yeah.
Yeah. You know, a while back I did some research and I actually saw a video on YouTube. I don't know who the guy was, but he was teaching on the body and how God designed the body to heal itself. And what he said was within 12 months' time, your body actually regenerates every system in your body every 12
Yes.
months. But if you're not in what they call it homeostasis, where your body is working properly, it may take longer for your body to and this is without medication,
Mm.
just eating and hydrating. Your every system in your body regenerates. But if you're taking medication, and he didn't say this, I'm saying this. I guess if you're taking medication and doing like what you just said, Tiffany, about the loop, taking that medication over and over, and then you're taking something else to counteract the side effects, your body doesn't have a chance to repair itself.
Yeah.
Doesn't. And
And I think,
is the side effect is your body being like, oh, now I need to heal this, or now I need to react to this, and now I need to react to that. So it's a mental change. It's refer to it differently. Your body's working when you get sick. So I say, thank you. You're telling me that I need to address something. I ate something or I'm thinking about something because our body reacts to our emotions, which is where a lot of illnesses come from, or there's something that needs to be addressed. That is what you need to go to first when you feel something, you know. Yeah. I could
yeah,
go on a tangent with this.
yeah. Our bodies get thrown out of alignment, just like Just like some people go to a chiropractor to get their back realigned or whatever joint. After a while, your body becomes misaligned and it just doesn't fire the way it's supposed to.
Mhm. Yeah, but yes, I love what you said about the doctor that said after 1 year, because I do know like some of our cells, I think our cells rejuvenate every month or every 30 to 60 days.
I think
So
it's
imagine if you're telling yourself, if you're giving yourself a break from as much as you can, and you're talking to your body, this is my new theory, I'm working on it. We could reverse our aging by just telling ourselves that we're healthy, we're pure, you're talking the water as it goes through you, everything is active, everything affects you. You know what I mean? I know that I know Gwen can surprise people with her age because she is so vibrant, so healthy. Like if I put you next to some people your age, and they would be like, "What?" And that's because of your diet and your belief system,
Yeah.
and I'm guessing the same with Diane, but I don't know if you want to disclose something, but I feel like it's testimony, it's testimony to what we're saying and eating natural if you wanted to.
Yeah. I'm
Yes,
72.
I will say to you that couple things. Well, first off of that, I did discover that there are um, the way our body is made up, we can rejuvenate ourselves, as you all are saying. And I came across that in some of my research, and there are telomeres, and there's all this medical technical stuff that I wrote about in my culinary memoir, Age-Defying, Soul-Inspired Plant-Based Cooking. And it's about your attitude, your mental attitude, and it's about how you feed your body, what you put into it. And then it's, the way the body operates. So you can slow down that aging process, if not reverse it. So I am coming into my 75th year in 2026, and I feel like I'm 35. Sometimes my body will tell me, no, you're not. But for the most part, yes. I mean, it is, you can tell yourself, you can kind of age backwards. I also wanted to bring up a point and wanted to hear what you all thought about this, like, the notion of fasting. Because we are talking about how our body rejuvenates itself, the cells maybe monthly, total system yearly, which is probably why birthdays came about, right? Because I look
Hmm.
at our birthday as another year of possibilities of, new things happening because you're rejuvenating yourself. But giving our bodies a chance, like we were talking before about recovering from certain things, and fasting does that. If you just kind of cleanse your system of some of the toxins that you expose it to, whether it's you're ingesting it or whether you're doing it in the environment somehow. What do you think about, fasting for a few days, or what's your opinion on that, each of you? Diane, and then Tiffany.
I think it depends on the kind of fast you go on. Um, some people fast sugar. They eliminate sugar for a while or permanently. I've tried what they call a Daniel fast, which is just vegetables and fruit, no dairy, no meats. Um, and I did this for 21 days, and I felt like a new person.
Mm,
I mean, it was like a miracle. It's like, wow, I
yeah.
got to keep doing this. But I think fasting helps.
Hmm.
It's you're giving your body a rest, and I mean, my oral hygiene was great. I didn't. You're not flossing dead meat out of your teeth. Dead meat. Um, but yeah, I think fasting is good.
I
Now,
used to do it.
how
I used to,
often? I don't know. I
Yeah.
guess it depends on the individual.
And I think yeah, and I think you need to listen to your body to
Yeah.
guide you as to how often it should be, or maybe listen, connect to the higher power. I used to fast in my, I don't know, 40s, I guess, a lot, and I'd take a weekend and I would just cleanse my system of everything. I only take in liquids, right? And I felt I had more energy. My brain, there was no fog. I felt that also when I stopped eating a lot of meat too. And just a clarity of everything. So I recommend it. I haven't done it in a while, but now I'm talking about it, I think I'm gonna, reincorporate that into my regimen. What about you, Tiffany? What do you think about it?
I've heard amazing things out of it. So yes, I've done a fast. When I've done it more like as a religious basis, like if I needed to align more with spirit, and so I could go on a fast, but only when I felt called to do it, because if I tried to do it on my own, I just couldn't follow through. But fasting as a benefit to the body, the reason why they're recommending it so much, and I guess it's always been there when they say finish eating by 6 and you don't eat in the morning, what you're doing is you're doing a night fast, right? Your
Yeah,
body, when it's processing food, it's working. So what the purpose of the fast to give it enough time is to like process the food and then use the food for your body. But if we are not giving it at least 12 hours, we don't have time to process. Our body doesn't have time to process it and use it. So I've
Right.
heard, and I haven't gone further into this, but if you fast for 7 days once a year, you can like cure your body of anything. Or you can't cure, your body will cure itself of anything because it will just work on re-regulating it to its perfect place. That's what our body's supposed to do, but
yeah,
we just don't give it a chance to do it.
Right. Yep.
yeah, yeah. Uh, you're right. We don't give it a chance to do it. We just need to listen to our bodies. Just listen to it. And I think you said this earlier about your body will tell you what you need. When you start having cravings for things, Tiffany, you were talking about that earlier. That's your body telling you that you need, and that you need certain things.
Yeah.
Some of us who have high blood pressure, for me, when I start doing some changes to my system, my regimen or whatever, I usually go to the extreme. And so when I was, told about high blood pressure and they wanted to put me on medicine and all that, okay, so I started staying away from sodium and, not eating pork and da, 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 da. But our bodies need some sodium. It's not,
It
so
needs a lot of sodium, actually.
yeah, yeah.
Yeah,
I
yeah.
learned that the hard way because I went to the extreme and I stay way away from sodium. But and then I suffered the consequences of that and realized that yeah, you do need some sodium. So I think Diane talked about balance. It's about a balance, but it's listening to your body to let it know, so that the body will let you know what it needs. So that when the cravings come, then you'll know that you need whatever, but in moderation. You don't have to go overboard. I guess I tend to go overboard with stuff, you know. Um,
Well, some of
so
the information out there is wrong. Like the sodium thing is
yeah,
just coming back around to be like, okay, they were wrong about that. They
yeah.
won't all admit it. My mom's doctor, when she went through that illness last year, with the sepsis and she had sepsis and pneumonia and um, some itis thing with her leg was swollen and like
Mhm.
everything, her body just stopped working. And then it hit her dementia. So it was quite a long process to get her well. But one of her doctors was like, she was diagnosed with high blood pressure for years. And he said she does not have high blood pressure. She has low blood pressure. That's why she gets dizzy a lot. And
Uh,
what happens when you have low blood pressure, your body wants to automatically fix it. So it shoots up the blood pressure. That tends to be when someone is like gets a symptom and they test themselves and it's high. And he said he discovered that a lot of people were testing for as high blood pressure when technically they're low blood pressure. So what he did, was told me to put salt in her water. She wasn't getting enough sodium. And he's I think he's Korean or something. He's like, we are not, this is probably not good to do on TV. So anyway, he said, we are not freshwater animals. We're saltwater. Our blood is saltwater. I mean, our water in our system is saltwater. So
Oh,
sometimes drinking just straight water all the time throws our system off. It's diluted. So putting
uh,
salt in her water was the magic key to lessening the dementia and her body healing and functioning again. Because he said when that water is going through the system and it's off, it doesn't have enough sodium and minerals and stuff, the body can't use it. And so that's what was happening. It leaks out. So when you see people with swollen feet, this is so basic. It's like the body, you're putting that water in your body can't use it because it doesn't have enough sodium. So it leaks out to the skin layers and then it just drips down. And then you have swollen ankles and swollen feet and an ineffective body and lack of oxygen in the head and lack of fluid in the head because it's just not going through the system. So therefore dementia. So when my mom starts
interesting.
acting crazy, I don't mean to say it that way, but if she starts saying things like that is very dementia-ish, I start making sure she puts water or salt in her water.
Mm-hmm.
And it's been for the last year since discovering all this and learning this. I don't know where it's going to go, or I'm super curious how many people might have been diagnosed with dementia that actually were just needed to put salt in their water or something. You know what I mean? Or like
Yeah,
in
yeah.
this cycle, my mom is in the cycle. Her body no longer responds or gives her the messages of being sick. So I have to watch her closely. So I use oils on her if she's getting sick. Antibiotics don't work as well. So I also add the oregano and I'll rub it on her. Your spine is a good place to put oils because
Mm-hmm.
it travels through your body.
Mm-hmm.
So I just tell her because when she gets sick, she's going to start getting dementia symptoms. Um, and that's the first thing I'll notice. And she's walking slower, more swelling and stuff. So I in the oregano and salt in the water. And it's normally a turnaround within a couple days.
You know, that makes so much sense. If
Doesn't
you
it?
go into the hospital, the first thing they do, if they keep you, they hook you up with a bag of saline.
Hmm.
They do. Mm-hmm.
See, it's still in
Never,
our face. It's so in our face. They
I
don't
never
want to
thought
tell
about
us. They know it's in our face.
Mm-hmm.
it.
Mm-hmm.
Wow.
Yeah.
I
That
am so
doctor
glad.
got in trouble. The Heart Association sued him for telling people to eat salt because his clients, his patients were getting off of heart medicine.
Who is this?
My mom's doctor, one of her doctors.
Oh, oh.
I
So,
think I think doctors know what the body needs. I think they're feeding off of the sympathy of the sickness, and they want to fix you. And a lot of doctors I've experienced personally have God complexes. And if
Hmm.
you don't want to do what they suggest you do, because I had this experience, they get upset. This one doctor, he had this twitch every time I just disagreed with him. And it's like, why are you taking this personally? This is what I choose to do or not to do. And you agreed to help me in pursuing health. But now you're upset because I don't, I know this thing does not work for me and I'm rejecting it. So, um,
I hope that he's a former doctor of yours
oh
and that
yeah, I
you
fired him.
found some, yeah.
Yeah.
I
Yeah.
fired him. And then I realized most of the doctors I've had were men. So
Hmm.
this new doctor I have is a female. And I figure females are probably more empathetic towards female issues than a
Right.
man. Because I've been told by several men doctors, it's all in your head. Well, to some extent, it is because, like you were
Right.
saying, if we talk to ourselves and talk to our body, it will shift,
Hmm.
But that was brutal when I first, oh, it's all in your head. No, it's not.
Right.
It's in my body. But anyway,
So as we close out this conversation, which has been fascinating, I mean, I'm learning so much, and I hope folks who are listening to this are learning so much too. What one thing, or maybe it doesn't have to be one thing, what would you like to close out this program with? What would you like folks to walk away with after having heard this conversation? What are you hoping for that they
We'll
take
let our
away
guests
from this?
go, Diane.
um, first off, I'd like to say I believe that our temples are they belong to God. God blessed us with these bodies we have, and we have to come to the place to where we align ourselves with what the Creator has given us and His formula for us to have divine health. We need to find out what that is. And I believe that there is no such thing as one pill fits all. Everybody is different. Just like our personalities and our fingerprints are different, our body, we all generally have the same systems, but our bodies function differently because of our genes, our genetics, our environment, and our diet. So I'd like to share that whatever anyone who's watching this is going through, doctors are good. You can go to them, get a physical, get your blood work and all that stuff, and then go from there, from the results of your blood work, to find out what you're deficient in, or you're doing too much, taking in too much of, and find that balance, between the doctors and your higher power and your own intuition, because it's your body. I think between the three, you should be able to come up with a solution where you can be in homeostasis as much as possible, or wholeness, healthy.
Yeah, beautiful. Thank you, Diane. I'm gonna go on top of that with what she said, because our bodies are a temple. Our bodies, at least in my faith, we are an expression of God. So God does not intend on making himself sick. This is why we actually can be and plan to be 100% healthy. And as far as using intuition, we can talk to our body. Very recently, I said, okay, I have this condition. I did an affirmative prayer over it. I'm like, I'm going to deny it, and I'm going to trust that I'm going to be given the steps to heal. And about 2 mornings later, I was told, eat more hydrating foods. And I was like, what does that mean? Eat more hydrating foods. This is me waking up, going into meditation. And then I got pictures of the different things I'm supposed to add to my diet.
Mhm.
And and so and that's how I actually do like all my medicines. I will just think about it or meditate on it, and I'll hear. That's how I heard about oregano, or I'll hear like rosemary. So I listen to spirit, I listen to my body, I look at what I'm craving. Don't just eat something, like literally think about, what am I craving at the moment.
Mhm.
I follow that first, and then I do the research, just to like be like, why did I hear this or whatnot, and it will always line up. So it's really like trusting your body yourself first and foremost, and be willing to argue with a doctor. You know what I mean? Use them as help, but nobody is more powerful than the mind of God, who you're attached to, and trust that, and trust your body. Know that you're an expression of God, and God doesn't make himself sick. So all that other stuff is nonsense. Like, illness is not part of God's plan for your body. But he knows all, so he knew that you would experience things, and look for it. Expand yourself to look for it, and trust yourself.
Awesome.
Yeah, I don't know that I can add to it, what the two of you have already said. I mean, it is a matter of knowing your body and trusting your body, listening to your body and responding to it, and then um, be able to identify a medical practitioner that aligns with your values, someone who will indeed listen to you. Because as I said before, you know your body better than anybody else, better than it. And so you have to identify someone who is willing to be a partner with you. Like this doctor, this medical practitioner, whatever they are, should be part of your health team, right? And if they are not, then you need to find somebody who is. But trust your instincts. It's about connecting to the higher power that gives you these signals and guidance, and trust the signals that you're getting from your body to work with a medical practitioner to come up with a solution that works best for you. And we're all individuals. There isn't one thing that is a remedy for everybody. Like we have to customize it to, whatever our needs are. And so that's what I hope everybody walks away from this conversation with. Empowered to, trust yourself to do the natural healing. And I know that Diane has some products that she's been working on that helps with that natural healing process. And I will put her contact information in the description section, as I usually do with myself and with Tiffany as well. So we'd love to hear your reaction to what you've heard from us today. So put your comments in the space below this video, and you might be invited to come on, just like Diane was. And before we had Rochelle on, so maybe you'll be invited to come on and talk with us about, a topic that of interest to you as well. And also remember to click on that button that says subscribe so that you will get a chance to uh, be notified whenever we post any new episodes. And there will be more coming, coming your way. So, on behalf of Tiffany Lee, I want to thank Diane Houston for joining us in this very rich conversation about natural healing. And we invite you to join us next time, and we'll see you then.
Thanks for having me. I enjoyed the conversation.
I do too. Thank you for coming, Diane.